recording, sharing. So what we're going to do today is a very important applied thing that we need to do if you guys ever want to do research, or if you ever want to train anybody, or if you just want to have a sense of kind of what people that you may care about, how they're doing in relation to their risk for particularly cardiovascular disease. Okay, so what we're going to do today is we're going to talk about what is referred to as a health appraisal. Okay, and I'll bring our favorite graph up again to like the 18th time to illustrate a point, right? This graph very clearly shows that if we are in fact more physically fit, or we're more physically active, we have a reduced risk of all-cause mortality. Exercise, good for us. Physical activity is good for us. I think hopefully we can all agree on all of that. Okay? There's one catch. Okay? There's one catch. And the catch is, on some occasions, exercise is actually not beneficial for us and it will kill us. Okay? The exercise itself will kill us. So, any of you that are going to go exercise today, you are going to take your life into your own hands when you go to exercise. Okay? So let's look at some of these kinds of things. All right? Especially vigorous exercise comes with certain risks. And one of those risks is sudden cardiac arrest. Okay? So it acutely increases our risk. So when you're sitting there, everybody has some level of risk of having a heart attack or an impairment in cardiac conduction at all times. Okay, it's tiny in y'all, it's minuscule. Okay, but when you go to exercise, it goes up. Okay, now when it goes up, it's still very, very rare, very, very small, but it still goes up nonetheless. Okay, so your risk of both of these things happening is going to go up when we go to exercise, and especially if we're going to do vigorous exercise, which we know gives us the best health benefits, it's going to go up to an even larger extent. Most of this is due to, in older populations, known signs or a known or diagnosed cardiovascular disease. Okay? In those of you that are non-cardiovascular sort of disease having folks, it's because of what we would call silent cardiovascular disease. You have something wrong that hasn't manifested yet. You have something wrong that has not been diagnosed, that nobody knows about. And then you go and exercise, and you make your heart work a lot harder, and poof, there it comes. Okay? Then it actually shows up. Okay? All right. So what we're trying to look at, okay, and this is especially important in older adults, like not me old, okay, but people that are maybe your grandparents' age or something like that. Okay? We're trying to weigh kind of the tipping point, okay, of, right, what's going to go on. There may be these sort of transient increases, right, that are gonna make us sort of make exercise risky, okay, coronary artery plaque ruptures and things like this, versus all of the potential benefits that we're going to get from regular exercise. And so what I hope that I've made very, very clear to you guys up to this point in class is that despite these increased risks during a bout of exercise, for the most part, in almost everybody, the benefits of regular physical activity, the benefits of regular exercise are much, much greater than the risk of anything else. Okay? All right. So the way that we try to get at all of this, the way we're going to combat this potential increased risk is through something called a health appraisal. When we do a health appraisal, sometimes it's called a health screening. What we are worried about is these two things, sudden cardiac arrest or myocardial infarction or a heart attack. So we want to try to find, are there people that are at an increased risk of this happening during exercise. We want to figure out if they're at an increased risk prior to beginning any kind of exercise. Okay? So we need to ask people certain questions. We need to undertake potentially a cardiologist examination. We may even need to put them on the treadmill, put on an EKG, and do what we refer to as a stress test. Okay? We need to do this before you go and exercise. Okay? How many of you guys go to a gym that is not here, that's not the hub? Anybody? Okay, a couple of you guys. Okay, Daniel, where do you go? To the Trinity. Okay, not familiar with it, but do you remember the first time you ever went there? Yeah. Did they make you fill out something? Did they ask you questions? Did they do any tests on you? I did fill out a waiver. You had to fill out a waiver. Okay, that waiver is not worth the paper it's printed on. If something happens there, you can still sue the shit out of them if you want. Just know all of that, okay? You did a waiver. Did you get to do anything else? No. They didn't ask you, are you a smoker? Do you have high blood pressure? Do you have family history of heart attacks? How old are you? Are you active? Do you have any other kind of things? Remember anything like that? I had to make sure that I was 18. You had to be 18. Okay. No health evaluation. It's not a great business model for you. Somebody's going to have a heart attack and they're going to end up owning Trinity Fitness, whatever it is, because they should do those kinds of things. Okay. Addison, I think you had your hand up. Where do you go? Do you mind me asking?
Downtown Fitness.
Downtown Fitness. Okay. Do they have, you remember the first time you went, did they have you fill out anything?
I think I filled out a waiver.
You did a waiver.
I
Don't remember.
I never signed a paper.
You signed a paper.
I don't remember what it was for.
Okay, somewhere right now, my wife is cringing at everyone. She's the person that like reads line by line and asks a bunch of questions. And we're going to do this and we're going to do that, which is super fun when you go to buy a house because you've got to sign like 45 things. You know, and she's like, wait, we got to read this and I got to read this and I got to read this and all of these things. She really, in some ways, should have been a lawyer. So she would say, make sure you know what you signed. Okay. Anybody taken an activity class with us? Yes? Devin, what class did you take?
Individual fitness.
Okay. I like to call that hide from my professor while I study or watch Netflix. I told you guys that I was walking behind some people that were in individual fitness like 2 weeks ago. One of my master students, it's her class. And I was running on the track and I was behind some girls that I'm pretty sure were in her class. And they were drinking coffee, like walking on the track, like drinking coffee, talking. And I was telling her, I'm like, you need to come up here, like get them to do something. So tomorrow during her class, we're going to offer everybody in her class a free absence if they can beat me at running a half mile. So I'm going to see if people have what they've actually been doing or not doing. Okay, but when you took our class, do you remember, did you fill anything out? Did you sign anything? Do you remember any of that stuff?
I don't think so. Because I missed the first week because I had COVID. So I don't know if they had to sign anything or not.
Okay. I'm not gonna ask you who your instructor was because it's better if I don't know. But you should have been screened. You should have filled out some questionnaires and had all of those things looked at. Anybody play a sport in high school? Okay, yeah, you guys did. Anybody remember if you had to have a physical or to get checked out by a doctor to get permission that said it was okay to participate?
No.
Okay. Did they ask you any questions about what's your blood pressure? Do you have a family history of anything? Or were they, I don't know, like I can, like, you know, they usually in the guys, they would, big thing where they would like tap and make sure your appendix was okay. And they check you for hernias and those kinds of things. They'd listen to you breathe and everything. Okay, I assume they do relatively similar kinds of things. Okay, so all of that is meant to, in an ideal world, check and see who's at risk. Okay, or we know there are certain things, right? that make some people be at a higher risk than others. Okay? And we're going to talk about what those things are. So that's the purpose of doing all of this. I'm going to ask a question on the test. Okay? Y'all should write this down. I'm going to ask a question on the test. It's going to be something like this. Okay? Who needs pre-exercise health screening? Okay? What groups of people do we need to make sure that we do pre-exercise health screenings on? Okay? Phoebe, what do you think the answer to that question should be? Everyone. Okay? Everyone. I don't care if you're the healthiest, most fit person in the entire world. I don't care if you just competed in the Olympics. I don't care what age you are or anything else. Okay? Everyone needs to be screened before they begin an exercise program. Okay? Especially if they're over the age of about 40. Okay? We can do some things in you guys and make some assumptions that y'all are young and otherwise healthy and for the most part, and we can do some kind of lighter screening. But especially in folks as you begin to get over the age of 40, we need a relatively detailed screening, okay, to make sure that people are going to be safe. Okay? If you're going to train people, if you're going to have them do any kind of exercise, that can be if you're a physical therapist, that could be if you're a personal trainer, okay, whatever it is. You're going to have people, if you are a doctor or a PA, that you're going to tell them, it's good for you to exercise here, let's do this and make sure it's safe. Okay. Everyone needs to be screened. Everyone. Okay. What we are looking for with the screening is to identify possible medical problems. This probably makes a lot of sense to you guys. Okay. Do you have cardiovascular disease? Has a doctor ever told you, Vale, do you have high blood pressure? Do you have elevated LDL cholesterol? Have you had a stroke? Okay. We want to know these things. That's going to be an issue. Okay. In the absence of actual diagnosed medical issues, okay, we want to look for characteristics that increase the risk of health problems. Do you have a family history of cardiovascular disease? Do you smoke? Are you sedentary? Okay. So things that, even if you've not been diagnosed here, that are risk factors for this. And we can look then at, are there people that have a certain number of these risk factors, then that's going to elevate their risk that they can have an issue during exercise. Okay. We also want to look for when you do exertion, like when you exercise, when you walk or something, do you experience what we call signs or symptoms that are indicative of a health problem? Okay. McKenna, what do you think a sign or a symptom is? Okay, yes, that you're 100% right. I was more so in a much more general kind of sense, okay? What is a sign or a symptom? What's a symptom? I'm feeling a certain way, okay? Like if I ask, like, what are the symptoms of COVID? Okay. Yeah, flu-like symptoms. I don't have taste. I don't have smell, right? So a symptom is a change in how you feel, how something seems to be functioning, right? That indicates there may be something going on. That you've got an infection or you have something that's wrong somewhere, right? Like today, I have the continued symptom that I've slept funny and continued to sleep funny, and I have tingling in my, more so in my thumb and kind of in my hand, which just tells me that I've slept weird last night at C5 and C6. Okay, that's a symptom. Shortness of breath could be considered a sign or a symptom, dizziness, right? Those are things. It's something that we can ask a person about, that can be measured, that can be quantified potentially, that indicates something's wrong somewhere. Okay. And we'll talk about what sort of signs and symptoms we should be looking for. Because what we're really looking for with these are signs and symptoms of an underlying pathology in the cardiovascular system, in the pulmonary system, in the metabolic system, or in the neuromuscular system that may put you at an increased risk of something happening during exercise. Okay. So we've already talked about, these are kind of the same thing they're going to be here. Lifestyle behaviors related to positive or negative health. So how many days per week you're active or you exercise, or if you don't do those things, are you a smoker? So we just want to know, do you have a disease? Do you have signs or symptoms of a disease that may come on when you are active? And then do you have other kinds of characteristics or behaviors that might put you in increased risk in the absence of those things? Although much more rarely done, if we have fitness test results, like we do for a lot of you, okay? We have an estimated Vo2 Max on you guys. We have an estimated sort of 1 rep max or a grip strength or how many push-ups or sit-ups you can do. That can tell us things, okay? None of you had a particularly low Vo2 max. But if you did, that can tell us maybe there's a cardiovascular issue going on or there's a pulmonary issue. Okay? So usually we need to get all of these things to say that it's safe to do the fitness test, and then we can use the results to kind of feed back into all of this. But on rare occasions, you may have fitness test results before you've got all of those kinds of things. Okay, so this was a mnemonic that was put together by Dr. Larson when she taught this class like ages ago. And it is called Mr. Please. You don't have to know this. I'm not going to ask you about it, but I think that it does a nice job of when we're looking at these medical histories and we're looking at sort of our risk factor assessment and those things, kind of what we want to look at. So we're going to do a medical history review. So we're going to ask you about your medical history. We're going to assess your risk factors. Are you a smoker? Right? Do you have high cholesterol? We're going to look at medications you might be taking. We're going to look at your level of physical activity. We're going to use all of this to decide if you need to go to the doctor and get physician's consent to begin exercising. Once we've gotten all of those things, we can do a fitness test, then we can set up your exercise prescription, and then we can evaluate your progress. So what we're really going to concern ourselves with today is these first 5 things, okay? Medical history, risk factor, medications, are you active or not, and then establish this need for consent from a physician to have you start doing things. This is the real part of the screening that we need to pay attention. Okay. So I'm going to hand out to everybody in class. And for those of you that are on Zoom, if you'll go on Canvas, you can download them. They're called screening questionnaires. You can download them, and I want you guys to look at all of them, okay? 2 questionnaires. One's called the PAR-Q, stands for the Physical Activity Readiness Questionnaire. And then the second one is from the American Heart Association and the American College of Sports Medicine, and it's called a Health Screening Questionnaire, the HES. Okay? I'm going to give you guys the PAR-Q. It's going to be a short questionnaire. The PAR-Q is ideally designed for older individuals that want to start doing like walking and things like that. Okay? It's not of much use to you guys because it's only for moderate intensity or light intensity activity. So if you want to jog, you need more than the PAR-Q. But we'll walk through that and kind of talk about the questions that are going to be on. Okay. Now, the American Heart ACSM screening questionnaire is much more thorough. Okay. It's going to get us things about medical history, current medical conditions, signs and symptoms, risk factors, okay, those kinds of things. All right, it's much more thorough. Okay. It's not 1, 2. Okay. So, a couple of things to keep in mind. All right, things to keep in mind. In order for any sort of screening or medical history to be of any use to us, people have to be willing to tell us the truth. Okay? They have to be willing to be honest with us. And so what we need to assure people of is when you provide answers to health screening questionnaires, any kind of pre-exercise screening, this is considered HIPAA protected medical information, which means that you taking that information can't share it with other people, including other physicians, without, or medical professionals, without the person's express consent. Okay. Now, usually, like when you go to the doctor, you sign a HIPAA form. What you're actually signing is a HIPAA release that says that the doctor can share it with other, like, referring physicians and those kinds of things, or other people in their clinic if they need to get another opinion beyond all of that, but they're not going to do it with anybody else. Okay. And so what that's going to say, so we've got the Hipaa Privacy Act of 1996. Okay. So fitness test results are considered personal health information. Height and weight are personal health information. Your physical activity levels, personal health information. Okay. Part of the reason that that is the case is that if that was to get out, insurance companies can alter your coverage or deny you coverage based upon these things. So that's why it's considered protected health information. Okay. So we need to assure people answer this questionnaire correctly and honestly, and we're not going to go around sharing your information. Okay. We are going to ask on the health screening questionnaire, what sort of medications do you take? Do you use recreational drugs? Okay. We need this information and we need it to be accurate and honest so that we can keep people safe. Okay. We are going to practice in my lab today with one of my master's students doing a Vo2 Max test. It would be useful to know if whomever we're going to practice on had taken cocaine an hour before they got on the bike. Probably not safe for us to do all of that. Okay. It would be useful for us to know if maybe they were taking fentanyl. Okay. This is stuff that may be illegal for them to do technically, but it happens. Okay. You guys would be surprised, or probably not that surprised. I'm always surprised when we do these questionnaires and I have to sign off on all of them when we test people in the lab, and you're just like, okay, well, I'm surprised at the number of people, the number of things that people do, but it is whatever it is, right? We can't share that information. You can't do anything, right? If we fill these things out and McKenna sees that Devin has done this, we're looking at her screening questionnaire and she sees that, I don't know, Devin's taking some medication for, I don't even know what would be, and some sort of disorder that Devin wouldn't want her friends to know, and McKenna can't run off and go be like, oh, what Devin's doing, you know, or doing these kinds of things. Okay. As an example of this, when I was a postdoc, we were doing a study and we were testing, and we tested a bunch of the graduate students in our department. And those of us that were on the study learned that another person in the department was taking medication for herpes. And no one else in the department sort of knew that. I don't know why we would, but we knew that you can't go off and share that information with other people. Okay. And so just things like that that you guys may not think about, but that's what's going to be covered and what we have to know in the midst of all of this. Okay. Now, I'm going to pass out the part Q to everybody here in class. The part Q that I'm giving you guys is newer than the thing that is in here. The questions are basically the same. Okay. I just need to pull up the PDF of this and sort of copy and paste this thing back in. So the form is slightly different, but it's basically getting at the same information. So for those of you on Zoom, you can pull it up. Y'all got the old version, I believe. Give one of these to everybody. What I want you to do is to fill these out. Okay. So this form is Canadian. It was developed in Canada in the 1970s. it was revised in the early 90s, and I swear it's been revised like twice since then. There's a chance that the one that I even handed out to you guys is not even the most up-to-date version. But it is designed to do pre-exercise screening for performing low to moderate intensity activities. So basically, anything that's walking for the most part, okay? Anything that's walking. In the old version that I have on here, if you answered yes to any of these questions, so this is what the old version looks like. Yes to any of the 7 questions on this old form, then you have to go to a physician to get clearance. This new one, it asks about your physical activity levels on one side, but I want you guys to flip it over and look at the side of the other questions. Okay. So it's going to ask you, are you completing the questionnaire for yourself, or are you completing it for somebody else? Okay. So the first thing that it does on this one is it says, have you experienced any of the following within the past 6 months? Okay. A diagnosis of or a treatment for heart disease, stroke, pain, discomfort, pressure in your chest during activities of daily living or during physical activity. So, have you been diagnosed with cardiovascular disease? Which is what this one says. Has the doctor ever said you have a heart condition and you should only do physical activity recommended by a doctor? Okay. It also asks, do you have or have you had any of these symptoms? Okay. Pain or discomfort in your chest. We'll talk about this in a minute. This is called angina. Okay, this is called angina. Pain in your chest, pain in your left arm on exertion, which is what the second question on the old version says. Do you feel pain in your chest? Okay. Have you had a diagnosis of or a treatment for high blood pressure? Okay. That's asked about down here in the old version. You are currently taking prescription drugs for high blood pressure. Do you have high blood pressure? You've been diagnosed. Do you have dizziness or lightheadedness during physical activity? Now, this is not, I went to CrossFit and we did 300 kip-ups as fast as we could, and we flipped over some tires and we ran as hard as we could, and now I feel a little dizzy. That's not what this is, okay? This is like I'm going to start walking and I feel dizzy, or I stand up too fast and I feel dizzy and I pass out, okay? That kind of thing. Not I worked out really, really hard. Do you have shortness of breath at rest? Do you have a hard time catching your breath at rest? So in the old one, we've got our dizziness here, right? It's asking again about chest pain. We're doing a little better about the dizziness and the lightheadedness. Do you lose consciousness or faint for any reason? Okay. Any reason. I think I told you guys the story that I had a student in class that she would faint when she fainted twice in one semester. First day of class, we'd been in there like 20 minutes. She's like, Dr. Black, I'm about to faint. Nobody freak out. Down she went out of her chair. Okay. She needed to get permission to exercise. So those are those kinds of things. This new one is added concussion. Okay, it's added concussion onto here. It's not a part of the old one as we've become much more, I guess, sophisticated about those kinds of things and appreciating the dangers of concussion. Then it says, do you currently have pain or swelling in any part of your body, such as from an injury, acute flare of arthritis, or back pain that affects your ability to be physically active? Okay. If you have arthritis, we need you to go get physician's clearance to do these kinds of things. I have back pain, but it doesn't really flare up. I'm just sort of stiff and old in that kind of a way. Okay. Other things that might be on there. Ladies, when you're pregnant, your ankles are likely going to swell up. Okay. It's a normal kind of thing. We're not talking so much about that kind of swelling, but sometimes if you have poor circulation and a cardiovascular issue, your ankles will also swell. Okay. As a healthcare provider told you, you should avoid or modify certain types of physical activity, right? That's going to be on here with this one. If you have any other medical or physical conditions that may be affected by being physically active, diabetes, cancer, osteoporosis, asthma, spinal cord injury, et cetera, et cetera. If you answer yes to any of the things on the FAR cube, you need to go to your doctor and get medical clearance. I promise you, your doctor, most of the time, unless you've got something serious, doesn't know any more about whether or not it's safe for you to exercise than what you're going to know by the end of class today. But yet, they're the ones that have MD after their name. So we're going to go and they're going to get signed off. And that way, if something happens, and people can sue them and not you. Okay? So that's this. This is really getting at, do you have a known cardiovascular or metabolic disorder? Do you have signs or symptoms that would be indicative of all of this, or are you taking medications for the cardiovascular disorder? Okay, that's all it's really doing. It's not getting at some of our other kind of more minor risk factors. Therefore, it's really only appropriate for doing moderate intensity physical activity. I'm not certain. I don't remember it. So if the fitness center makes you guys do one of these now or not, when you go over and sign up or not. It's been a while. They didn't make me sign one when I redid my membership this year. Anybody remember? Anybody work over there? No. I feel like when I first signed up, like years and years ago, they made me fill out a Part Q, but I'm not certain if they do or not. Okay. If they don't, they should. Okay. So the next part of this, let me see what's going on in the chat, is we're going to call the Acsm risk stratification. Okay. This is going to be done using the health screening questionnaire. So I'm going to pass this out in a second after I talk about this, because once I give it to you guys, then y'all are going to start working on it. And then you're not going to pay attention. Okay. This is the thing that addresses a host of diseases, signs and symptoms, and then potential risk factors and underlying things. This can serve as an initial medical review or kind of way to also get medical history. Okay. When we do this for our class, we're going to put you into 3 categories. Okay. I'm going to teach you this, and then if you go and you take exercise testing and prescription, then Dr. Larson and Dr. Kellewan will teach you about a more sophisticated and a more updated, a better way of doing this, where there's several other kind of tiers in the midst of this. We're going to do it this way because it's at least a good introduction and a straightforward thing. Okay. We're going to classify people, and you're going to do this for yourself, and I'm going to show you some practice ones. We're going to do it for them as either low risk, moderate risk, or high risk. Okay. If you are a low risk person, it's easy. You can go do whatever you want. We think it's safe. Do whatever you want. Nobody cares. Okay. If you're a high risk person, you get to do nothing. You have to go to the doctor and get clearance. Okay. If you're a moderate risk person, you're somewhere in the middle, then some kinds of activity will be deemed safe and reasonable and okay, and other ones will not be. Okay. So I'll walk you guys through how we're going to do all of this, what this means, and how we do the stratification. Okay. Okay. First issue. So think about this for yourself, and then I'll give you a questionnaire and you can fill it out. Okay. The first objective of this questionnaire is a kind of medical history review. We're going to screen with this for 3 major chronic diseases that can have an effect on your ability to exercise or could be made worse by exercise. Cardiovascular disease, a pulmonary disease, some kind of pulmonary disease, something with your lungs, and then a metabolic disorder, which is really diabetes. Okay. These are the 3 things. Of these, you see pulmonary disorders in older folks, but in folks that are sort of my age or a little bit older, like their parents' age, probably cardiovascular disease, and then type 2 diabetes are going to be the most common things that you will encounter. Okay. So we asked people, do you have diabetes? Okay. Yes or no? Do you have cardiovascular disease? Have you had a stroke? Do you have high blood pressure? Right? Have you had a heart attack? Okay. Or do you have a pulmonary disorder? Do you have asthma? Do you have COPD? Okay. Do you have emphysema? Something like that. We ask. If anybody says yes to these, you're high risk. Over, done with. Do not pass go to the doctor. Okay. Let's assume that the person you're filling it out, that you're having fill it out, doesn't have a diagnosed disorder. Next, we're going to look for signs or symptoms of those disorders. Do you have angina with exertion? If you have angina at rest, you're basically having a heart attack right then. You need to call 911. Okay? But do you have angina or sort of left side, left arm, kind of left top part of your chest pain that gets brought on during exercise? Not from its Monday, it's bench press day, but sort of this crushing, kind of aching, burning pain that's going to be there. This is a very typical sign or a symptom of somebody having a heart attack. Unusual shortness of breath at any time. Okay. I don't know how we define unusual. I don't know what usual shortness of breath would be. Right. I suppose usual shortness of breath was I was running up and down our driveway, sprinting as fast as I could, holding my daughter yesterday, having her fly like an airplane. And after about 5 of those, I'm like, I'm about to keel over. I'm out of breath. Okay. You guys try like carrying an extra 40 pounds around that's wiggling all at the same time while you're trying to run. Okay. That would maybe be usual shortness of breath. Okay. But anything that we might deem unusual. Dizziness or syncope. Syncope is basically dizziness and fainting. Okay. Heart palpitations or tachycardia, which is an elevated heart rate, or an irregular heart rhythm. I don't know how you're going to know if you have an irregular heart rhythm. Okay. The only way you know you have an irregular heart rhythm is if you've been to a cardiologist, they've done an EKG on you, and if they know you've got that, then you have diagnosed cardiovascular disease. But maybe somebody knows this and they've not been diagnosed. I don't know. So we're worried about this. Okay. Elevated heart rates, palpitations, irregular heart rhythm. Unexplained ankle edema. Not I'm pregnant. Okay. Not I've been hanging from my hands and all the stuff has gone down to my legs. I don't really know. Okay. But ankle swelling would be very much indicative of congestive heart failure and some other things, or what we call intermittent claudication. So intermittent claudication is basically angina in your feet, okay, or in your lower legs. There is a disorder called peripheral arterial disease that I'll show you guys some terrible pictures of probably next week, okay? But it is lack of proper blood flow into areas in your lower extremities. It especially affects your feet. It especially comes on during exertion. You're here, you're at rest, it's fine. You start exercising, you start doing things in demand for blood flow in the muscles in your calves, into your feet, goes up, you're unable to supply all of that. You get ischemia, you make lactic acid, the hydrogen ions cause this burning sensation. It is apparently quite painful. Okay, that's called intermittent claudication. It's intermittent because you stop exercising and it goes away. Okay, you start doing stuff and it comes back. So this is going to be an issue that's going to tell us about if you have peripheral arterial disease. Okay. Okay. Let's say you have none of those. You don't have a diagnosed disorder. You have no signs or symptoms. Great. You're not a high risk person. Okay. You're not high risk. After that, then we want to ask you about risk factors. These are going to be behaviors or characteristics about you that predispose you to being at a greater risk of having an underlying cardiovascular disease that may not have been diagnosed yet. Okay, so the first of these is going to be separate from these other 7. Okay, age is a risk factor. Age is a risk factor. If you have a man who is 45 years old or older, they're high risk. Go to the doctor. If you have a woman who is 55 or older, she has to go to the doctor. Okay? So this is a thing that is going to be separate from all of this, but it's not really considered a sign or a symptom or a known disorder. So I'm rapidly approaching the I have to go to the doctor if I want to start doing some kind of exercise. Okay? These next 7 things are our primary risk factors for cardiovascular. They're really primary risk factors for coronary artery disease. So disorders of blood flow going back to the heart, which is the primary thing that leads to heart attacks and sudden sort of impairments in myocardial conduction. Okay. The first is what we call family history. So please don't get these numbers confused because they're age ranges, but they're a little bit different from your age. Okay. If you have a male first degree relative, okay, a brother or your father, who has had a heart attack, so they've had an infarct, they've had coronary revascularization, so they've had a stent put in, or they've had bypass surgery done, okay? If they've had those things done before the age of 55, okay, before the age of 55, that's considered a risk factor. If you've had a female first degree relative, so your mom or your sister, okay, and these have to be first degree, I should say, blood relatives, or what we think of as blood relatives. So your biological father or your biological mother or brother or sister. Okay. Stepbrothers and stepsisters or things, especially if it's from kind of blended families and it's their half brother or whatever, then things get a little bit tricky. But male first degree relative 55 or older, or 55 or younger, female relative 65 or younger. Okay. Ladies, y'all are at a much reduced risk of having cardiovascular events than guys. Okay. In y'all's age range, women, y'all are about 1 in almost, it's like 950,000 times that you go exercise would potentially be at risk of having a heart attack. Guys, it's like 1 in 100,000. Okay. And you get to be my age, and it's like 1 in 10,000. Okay. And in the women, it's still more than. Are you currently or have you recently quit smoking? A current cigarette smoker or quit within the previous 6 months? Okay. Your next question is, what does it mean to be a smoker, Dr. Black? I don't know. Okay. We have a hard time defining all of this. I would say if you're a person that smokes more than like 1 or 2 cigarettes in a week, I know sometimes people are social smokers. Maybe you will smoke a cigarette if you're out with your friends or something because other people are smoking and do that much once every couple of weeks or something. You're probably not really a smoker. But if you're a smoker or you quit within the previous 6 months, that's considered a risk factor. We don't have data on vaping yet, so I don't know how we would classify people that vape. If it was me, I might count them as the same kind of thing. Are you sedentary? Okay, you get less than 90 minutes of physical activity per week. It's not just you don't meet the ACSM guidelines, it's not just you don't meet the 150, but you get less than 90 minutes per week for the previous 3 months. Are you obese by BMI? Or if you're not obese by BMI, do you have a waist circumference, waist girth of greater than 40 inches if you're a guy, so that's 102 centimeters, or 35 centimeters, which is 88 centimeters for women? Okay, that's considered obese. Are you hypertensive? You have a systolic blood pressure greater than or equal to 140, or a diastolic pressure over 90. To be hypertensive, you just have to have one. Okay, you just have to have one. You don't have to have both of them over there. Are you dyslipidemic? Okay, which means you have elevated cholesterol. You have an LDL cholesterol level of 130 milligrams per deciliter of blood or greater. You have an HDL cholesterol, good cholesterol less than 40, or total cholesterol, that is greater than 200 milligrams per deciliter. Okay, that's going to mean you are dyslipidemic. I'm sorry, you guys are just going to have to memorize these numbers. Okay? I don't ask you guys to do a lot of these kinds of things, but you just got to memorize these numbers. Okay. How many of you know your cholesterol numbers? Nobody? So Matt, what should we do? We don't know your cholesterol numbers. What should we do when we screen you? Sorry? Okay, we could use another risk factor, sure. Okay. If we don't know something, we should probably count it as a risk factor just to be super safe. Okay. We don't have a really good way to handle sort of LDL and these things, but generally, if the person isn't hypertensive and they're not obese, okay, then we don't worry. If they don't know, we don't count dyslipidemia against them if they don't know their numbers. Okay. The last one is prediabetes. Okay. There is something called impaired fasting glucose. So this is your blood glucose level first thing in the morning. All right, first thing in the morning. You wake up, you stick your finger, we measure, we see how much glucose is in your blood. Okay. If you have more than 100 milligrams per deciliter, but less than 126 milligrams per deciliter, you are what we call pre-diabetic. Okay, pre-diabetic. Or you're a sleepwalker and you went and ate a bunch of Halloween candy in the middle of the night and you didn't know it. Okay. So what this means is that you've got more glucose in your blood than we would normally expect for a person who's been on an approximate sort of 8 to 10 hour fast. Okay. If you're over 126, then you're actually diabetic probably. Okay. Normal is under 100. Okay. I'll ask you guys this. Anybody know what your blood glucose levels are? Nobody? Okay. Dan, you know your blood glucose levels?
I know
Okay. How long ago did you do that? About a year. Okay. That's better than nothing, but a lot can change. Okay. So if we don't know this one, again, we look at obesity. We look at sedentary and obesity, okay, rather than hypertension and obesity. If you're not obese and you are not sedentary and you don't know your fasting blood glucose, then we don't count it against you. Okay. So I'm very hopeful that for next semester or for next year, whenever we actually go back to doing things in person, we're going to do a lab where we're going to do a finger stick, and you can buy a machine that measures both of these things simultaneously. And we'll be able to actually do all of that in one topic. Okay. Okay. All right. So let me walk you through how we do this risk stratification, then we'll take a break. Then we'll come back and you guys will try to practice all of this. Okay. So you can be high risk, you can be moderate risk, or you can be low risk. Low risk people can do any kind of exercise or testing that we want. So these are men or women, men under 45, women under 55, who are asymptomatic, okay, and have no more than one cardiovascular risk factor. So you don't have a diagnosed disease, you have no signs or symptoms, okay? You're a guy under 45, you're a woman under 55, and you have 1 or 0 from our list of 7 risk factors. Okay. Those people, we can tell them it's probably very, very safe. You can go do whatever you want from an exercise standpoint. High risk individuals, you've got 1 or more signs or symptoms, or you have a diagnosis of having a cardiovascular, pulmonary, or metabolic disorder. If you're high risk, you're done. Go to the doctor. Okay. We don't ask any questions. I don't let these people walk without getting physician questions. So moderate risk is where things get a little wonky. Okay, this is where things get a little bit wonky. So men who are 45 and older, women who are 55 and older, okay, who are asymptomatic, so they don't have a diagnosed anything, they're asymptomatic, they're considered moderate risk, which means you can do walking exercise, but if you're going to do anything more than walking, you need to go to the doctor. So I basically say that if you're over 45 or you're over 55, if you're a man or a woman, then you probably should just go to the doctor, because Lord knows practically no one just does walking. Okay. If you're younger, so you're a man under 45, a woman under 55, you're asymptomatic, and then you have 2 or more of our risk factors. You're obese and you're a smoker, okay? Which could be any number of college-age people. You're moderate risk, okay? You're sedentary and you have high cholesterol and you have impaired fasting glucose. Okay? Where this gets tricky for everybody, 2 or more, okay? You can have all 7, right? You can have high blood pressure and be a smoker and be obese. You can have all of them. That doesn't make you high risk. It's just keeps you at moderate. Okay? Please don't confuse that. Okay? Please don't confuse that. People that are moderate risk, okay, they can do light and moderate intensity physical activity without physician's clearance. Okay? Out physician's clearance. If we want to do vigorous intensity activity or any kind of fitness testing, which usually involves vigorous intensity activity, we need physician's clearance. Okay? We need physician's clearance. Okay. We're going to pause here. It's 11:29. At 11:35, we'll be back. I'm going to put you guys into groups. We'll do some breakout rooms on Zoom. And I will show you guys some case studies where you're going to have to look at a person's sort of signs, symptoms, medical history, risk factors, etc., and then make some decisions. Are they high? Are they low? Are they high? Okay. All right. So we'll take a little break and we'll come back. All right, Zoom folks, for your groups, there were 4 of y'all. Just start throwing out what you got, low, moderate, or high. All right, chasing people away.
Low.
All right, Lauren says their group said low. That's one group.
Low.
I don't know who that was, but
It was
another
Ramsey.
low. I'm sorry?
I said it was Ramsey's group.
Ramsey's group says low. All right, I got 2 of the 4. My other 2 groups. All right, Jordan's group got moderate. You can type it in the thing if you don't want to talk. We're waiting, and then Dan said low. Okay. All right. So out of 8 groups, we got 6 lows and 2 moderates. Okay. Anybody want to change your vote before we talk about this? Now that you've seen how other people did this. Anybody want to change? No? You're happy? You're confident? Neither. All right. So my first group, you guys, y'all said they were moderate. Why?
We counted smoking as a positive risk factor,
Okay.
and then the unknown vaccination risk.
Okay. So You said smoking is a risk factor, unknown fasting blood glucose. Okay? That seems, let's say, smoking, fasting blood glucose. Okay. Probably y'all's group was low. Why?
We, just include smoking. Glucose, because the other areas.
Okay. Okay. All right. So let's talk about these things. Let's walk through our deals. All right. Is age something that would have pushed her one way or the other? You guys. Yeah. She's 21. Okay. Yeah, okay, I understand. I was like, is she old enough that would matter?
No.
Okay. Does she have a known or diagnosed cardiovascular disease or pulmonary disease? Or is she diabetic? Okay.
No.
Does she have any signs or symptoms? No. Okay. So from that, we can rule out she's not high risk. We're okay on the age, all right? What are our other 7 risk factors? Okay. What are our other 7? First one is smoking. Does she smoke?
Yes.
We all, okay. Yes. So we're counting smoking. Okay. 10 to 20 cigarettes. Okay. This is a weird one because there. So we're going to say she smokes. Does it matter if she drinks alcohol? Okay. Her liver's functioning fine, and we don't really care. Okay. We don't really care. It's not a particular risk factor for cardiovascular disease. Is she obese by BMI? No. Okay. Does she have high blood pressure? No. Okay. What about cholesterol? Is her total cholesterol a problem? What is our cutoff value? 200. Good. What about her LDL? Okay. What's our cutoff value for LDL? 130. Good. Okay. Is her HDL too low? No. HDL is 5. Okay. Fasting blood glucose, we don't know. But, okay, she's not obese by BMI. Our other secondary thing could be, do we care if she's taking oral contraceptives? No, we don't care. We haven't talked about that, but we don't care. Okay. Attends group exercise class 2 to 3 times a week. So do we think she gets less than 90 minutes of physical activity or more than 90 minutes of physical activity? Do we think she's sedentary, basically? Why? How do you know that?
I'm assuming the exercise class is an hour long.
Do we know that?
No, but even if it's 30 minutes long.
And what if she only goes 2 times a week and it's 30 minutes and she doesn't do shit otherwise? Okay. Did any of you think, maybe she's actually sedentary? Or do you all say, oh, she goes to exercise classes, of course she can't be sedentary, right? Y'all are like 95% correct, okay? But this is the kind of stuff that you're gonna get. You're gonna ask people, how much activity do you get? I don't know. Some weeks I go twice, some weeks I go 4 times a week. You're like, what do you do? Well, like, what is the group exercise class? What if it's yoga? Is yoga physical activity? Having done yoga only a few times in my life, I would say yes. For me, it is. But I mean, it's not like running or going to, I don't know, or doing that 45 or something over in. That's tough. Okay. No symptoms. Parents are both living in good health. Okay. Does this matter? Is it enough information? Could they be living and someone think they're in good health, but they've had a heart attack? They could. Okay. So hopefully you guys are beginning to see the difficulties in trying to do some of this, okay? This one came specifically out of the American College of Sports Medicine, one of their study books for one of their certification exams and things, and it's a total pain in the butt. I would argue that probably the person is low risk, okay? I think that's even what they say, is that the person is low risk. But you could argue that we know they're a smoker, okay? And you could argue that we don't know their fasting blood glucose, and we don't really know whether or not they are sedentary, and how much activity they're getting. We don't really know if their parents if they have potential for a family history, even though the vast majority of all of that is probably going to be fine. So you can say that they're moderate. That wouldn't be wrong. The most correct answer to me is probably low. Okay. All right, let's do another one. All right, let's do another one. I'm gonna put the breakout rooms back. In the breakout rooms, you guys just got to go forward one slide and you'll get the next one. Okay. So we're gonna go back to breakout rooms. When you're done in your breakout room, just get out of the breakout room, type what you found into the chat, and come back to the rest of us. Okay. All right, breakout rooms are open. Here we go. All right, everybody in here done? Almost everybody is back from the breakout. Right? Madison, are you okay? Yeah, you're just like all like tipped over. Somebody remind me, and I'll put a picture in on Wednesday, that my daughter, I don't know if they've been dancing or doing something at daycare, but she now understands the concept that you can like dip a person when you dance. And so she wants to like dance around with us. And she was like, Dada, I dip you. And then I have pictures of her trying to dip my wife. And she's like got her like hands under my wife's leg and like dipping my wife over. So I'm sort of like taking a picture like in the background in case she gets slumped over. So that's what that makes me think of, is you're sort of like all like doubled over there. So we'll go back around the other direction. So McKenna, y'all's group, what'd y'all get?
Low.
Okay.
We said moderate. You also said moderate. Low.
Low. All right, let's see what the Zoomers are doing. Let's look in chat room and see what we're getting. I've got low and I've got moderate. I need to hear from my other two folks. So moderate, low, and moderate. Moderate, low, and moderate. Okay, let's do this. Nikki, from your group. Nikki, from your group, you all said moderate. Why?
We said moderate because of his age.
Moderate because of his age. Okay. All right, so the other one, let me see. Kathy, your group said low for number 2. Why did y'all say low?
He doesn't have any, wait, can you hear me?
Yep, I can hear you.
He doesn't have any diseases or any like major symptoms, and he only has one CVD risk factor, which is low.
Okay. Okay. My in-class group. We'll start over with Riley and McKenna and Daniel. Y'all said low. Why? So he's low because he's over.
That's the only risk factor.
This is the only risk factor. Okay, I see what y'all are doing. Okay, come back to that in just a second. Devin, Vale, y'all said moderate because of his age.
And because in the family history of heart attack.
Okay. You guys want to talk to them about the age thing and how y'all interpreted the age versus them interpreting the age? No?
Because he's 54 and he's over 45.
Right. It's not a risk factor. It's a deal breaker. So it's not included with the 7, guys, remember? Age is not part of the 7. So were y'all thinking everybody thinking it was?
Yeah.
Oh, so y'all are like, oh, it's 2 because of all of that. Okay. So, haha.
So
He's instantly moderate because he doesn't have signs or symptoms. He doesn't have a known disorder. But then because of his age, he's moderate. Don't have to read anything else. Done. Okay. So I see how you can arrive at this. Y'all were interpreting everything else correctly. Okay. Although maybe y'all weren't, if you were thinking that he didn't have a family history of those things. Okay. So this is why we do this. If there's no signs or symptoms and no diagnosed disease, the first thing we do is look at age. Okay. If they're over a certain age, they're automatically moderate. If they're under, then we look at the other 7. Okay, then we can look at the other 7. Good. So we'll remember that now. This is why we do this. Okay. That's how we get it. Okay. To my folks on Zoom, does that make sense? You know, give me some thumbs up or flash your screens at me if you think that makes sense. Yep. Okay, sweet. All right. Y'all want to do one more? Or do y'all want to go? There will be multiple of these on your test next Monday. If y'all want to go, I can bring more. We can do more on Wednesday. I don't really care. Okay. Okay.
I was just gonna say, for the ones that you put on the test, are they gonna be like very straightforward?
I will not do some wishy-washy thing about like, well, she goes and she does this for maybe 2 or 3 times a week. I will try to be much more precise on time and those kinds of things. Yes. Yes. I want to know if you know how to do the thing. All right, here's what I want everybody to do. Everybody, please listen. Okay? Here's what I want you to do for Wednesday. There will not be lecture on Wednesday. There will not be lecture. Okay? What we're going to do is it's just going to be kind of catch up review day before the test. All right? I envision that many of you all here, I'm not coming to class, Dr. Black, on Wednesday at all. That's fine, but I'm not going to record it. Okay? I'm not going to record whatever we talk about. If you're here, you're here. I'll keep the Zoom open. You guys can zoom in. That's fine. What I want, though, for you guys to bring is this. Here's your assignment. I want you to have 2 people, 2 of your friends, to fill out the health screening questionnaire that's on Canvas. Okay? And you're going to turn that into me on Wednesday, and I'll give you an assignment grade for it. But part of what we will do with those, don't have your friend put their name on it. Okay? You don't have to put their name on it. They just need to fill it out. Is we'll grab a couple of those randomly and we'll share them and we'll talk our way through those as possible case study scenarios. Okay? Otherwise, I'll answer questions. I'll go back over whatever you guys want. We can talk about stuff that's on the study guide, et cetera, et cetera, et cetera. 2 of you, and you know who you are, still need to get your BIA and waist and hip circumference measures done. I need those done today. I've made arrangements with one of the 2. Okay? So if you've not done that, talk to me today. We'll get this done. I'm going to get those numbers to you guys hopefully this afternoon or first thing in the morning. Because the test is Monday of next week, you all will have until Wednesday of next week to do the 3rd lap. Okay? I don't want to make you have to work on all of that and then go and do that. However, there will be on the test, okay? And we can practice this on Wednesday. There will be a skin fold site question and how to do the math and plug the stuff in for doing that calculation, which is in the notes and things and in the lab on the test on Monday. So we can walk through that then too. Okay? All right. Good deal. Welcome to November. Hang on to your par Qs. I just want whatever you did for your risk stratification. Okay? For my Zoom folks, y'all email me whoever was in your group, and I'll get you guys class credit for that too.